Why is it important to identify behavioral health problems in health professionals?
Health professionals have worked so hard to provide quality services to their patients and their communities. If we think about the sacrifices they have made in terms of, education, years of study, endless hours of work and supervision, but also the sacrifices that their families have made to help them succeed, the sacrifices that, all of us make to fund university and training programs, it's high. And health professionals who have, for whatever reason, developed behavioral problems in the workplace can't practice effective, safe medicine. And that's why it's so important to prevent behavioral problems in the health workplace.
What impact does an untreated behavioral health problem have on the health professional, their colleagues, and their patients?
Behavioral issues have all kinds of effects on the individual and those around them. So let's think about the health professional first. Most health professionals with behavioral issues actually have good insight into that. They often feel ashamed, embarrassed, sad, frustrated, and often the issues are not issues of poor motivation, and they don't show up to work expecting to have bad behavior. But they often know that they may be lacking skills to cope with the demands of a highly complex environment. So for the individual health professional, the impact can be devastating. And unfortunately, it tends to compound the underlying problems. And then if we think of those people around the health professional, they're often the silent victims in behavioral outbursts and challenges. They may develop issues of coming to work. They may choose to leave their workplace. Issues like absenteeism may arise. But other more complex things can happen. Sometimes behavioral problems can spread in a workplace. It can become a cultural norm. And then not only do we have a health professional with inappropriate behavior, but we have all of those around them developing similar behaviors, often as a way of defending themselves.
What signs might one look out for that a colleague is suffering from a behavioral health problem?
I think some of the inappropriate stereotypical descriptions are things like surgeons throwing instruments in the operating room, internists having tantrums in their waiting areas, emergency doctors losing their cool, and these professions, these disciplines are no more prone to disruptive behavior than others. And of course, these are examples of disruptive behavior. But there can be lots of ways in which our behavior can be disruptive to the delivery of quality health care. So for example, not answering pages in a timely manner, not completing health records on time, not engaging in respectful communication with other health professionals, patients, or families. Those can all be ways in which our behavior is disruptive. So I think for all of us in healthcare, it's important to be open to a notion that unprofessional behavior has a spectrum of examples, and the best thing we can do is just be open to identifying that and giving people feedback. The health environment, particularly for those people who work in hospital settings, is the most complex culture that we have. Hospitals are very challenging places to work, multiple models of accountability, regulation, discipline, and of course a lot of frameworks in which health professionals work with are under incredible stress. And I think if you took any reasonable person and put them in such a complex environment, you're gonna see slips of professionalism, and part of that is very normal. Where we draw a line around those behaviors is in our interface with each other and with patients and families when we're in our professional role. And that's why it's so important, and I think why we have much to celebrate that our medical schools, our universities, our hospitals, our medical associations have all been working hard, very hard, for well over a decade to promote professional behaviors by health providers. I think the state of our understanding of behavioral health issues is very good, and treatment works. But all good treatment starts with a good assessment. So most programs that help health professionals with their behavior start in the spirit of assessment. And often it means that you're going to meet with the identified individual, You want to know their story. You want to know their health status. You want to know their social status. You want to know about their workplace. You want to know about their strengths, their vulnerabilities, their challenges, because they're a human being just like us. So by understanding their story and their health history, we can learn a lot about what's going on for that doctor. It's also important for us to consider what's going on in their practice environment. Some practice environments are toxic. And you take really good people and you put them in a toxic environment, things are going to happen. So it's important that we be open to the construct that perhaps the problem's not with the health professional, perhaps the problem is with their environment. And then the third part of assessment is being open to the dynamic and the interplay between the health professional and the work environment. And by starting with a detailed assessment, we often will identify things that can then be treated or remediated. So for example, there's reasonable data to show that about 85% of doctors who are identified with disruptive behavior have an undiagnosed or undertreated mental health problem, including substance use disorders. Well, we know how to treat that. That's a good news story. For the other 15%, it's a little more tricky. We might have to look at behavioral approaches. That can involve things like education remediation. It could involve things like ongoing feedback. It could involve coaching by a certified executive coach. Or. Our strategies in those scenarios may look different, but they exist. So I think the bottom line around treatment is a very hopeful one. Disruptive behavior can be addressed. Behaviors can improve.